why is it important for someone to know if he or she has diabetes or even prediabetes?
Absolutely. So that we're seeing, for instance, with my neurology colleagues, that there are patients who present with peripheral neuropathy, meaning that they have pain in their lower extremities, in their feet, up their legs. It can be all kind of manifestations: pain, lightning bolts, numbness, walking on cotton ball. And they can have those complications that are like you would see in diabetes, even in a pre-diabetic state. So neurologists are diagnosing patients with prediabetes already having some of the classic complications of it. We know that patients with prediabetes or the metabolic syndrome are at high risk for cardiovascular problems, heart attacks, death, stroke, early mortality. So we begin to see some of the same problems that you see in patients who have frank diabetes that you see with prediabetes.
Right. I mentioned in the intro that it seems like we're hearing more about diabetes and the numbers rising. I'm curious if there are some recent studies on just how prevalent diabetes and prediabetes is.
Well, absolutely, it definitely is increasing from prediabetes to obesity in younger population, as well as aging. So as our population is getting older, we're definitely seeing higher rates of that. Authorities like the CDC are 57 million who have prediabetes and closer to 23, 24 million who have diabetes.
Okay. Right. Now I'd like to move to addressing how does someone know for sure if he or she has diabetes. And let me start by asking, are there certain warning signs or symptoms that might alert them to this?
Well, the classic, we think of excess thirst, excess urination, and excess hunger. So polydipsia is the excess thirst, polyphagia is the excess hunger, and polyuria is the excess urination. And how I ask questions to patients about that is, do they feel that they're constantly needing to drink something? They've had a tall glass of water only to chase it maybe in an hour with another tall glass. That may lead to having to constantly going to the bathroom, waking up in the middle of the night to go very frequently. For men kind of over the age 50, sometimes that's a problem with a large prostate. And the way we try to distinguish it is that men with a large prostate who may have this urgency to go to the bathroom very often to urinate, they may only then just urinate small volumes, where someone with problems with blood sugars is really urinating pretty large stream and very frequently. They'll feel very hungry. They just had a very large, nice, satisfying meal, and an hour later feel hungry again. Other symptoms that are classic for diabetes are blurred vision. They may go to see their optometrist or their ophthalmologist to get their lenses changed, and then typically that may be the question raised is, do you think you might have diabetes? So the three polys are classic. But like as I explained earlier, sometimes patients can present with pain and numbness in their lower extremities, and that could be a clue that there's actually diabetes. We've seen cases where patients presented to the emergency room with chest pain, shortness of breath, heart attack, and that's when diabetes was diagnosed.
Well, if someone's not having any of those warning signs or symptoms, but they may have certain risk factors. Are there certain risk factors that people should be aware of?
Yeah, so one is family history, especially for type 2 diabetes. It's pretty strong. So that's something to bring up to the healthcare provider, physician, or mid-level, is about the family history for diabetes. Hypertension, high triglycerides defined as fasting over 150 if they have a low healthy cholesterol. So for women that's less than 50 and for men less than 40. If they have fasting blood sugars that are impaired. Now, most patients aren't monitoring their blood sugars, obviously, if they don't even know that they have diabetes or prediabetes. But sometimes you can tell on routine lab tests that the doctor may be ordering as part of their yearly physical exam. And that's where you want to pay attention and maybe have your audience members say, I'd like a copy of my lab tests. I'd like to have them for my files in case I need to go somewhere else. They can look at these glucose levels in that comprehensive metabolic testing, and anything that's between 100 and 125 would be this impaired fast. So that would be a risk factor. women who give birth to large babies, women who have abnormalities in their menstrual cycle like polycystic ovarian syndrome, and then those who are in certain ethnic groups, Hispanics, Native Americans, Asians, African Americans are particularly at high risk for development of type 2, particularly type 2 diabetes, because it's 90% of the types of diabetes is type 2, so it's the most common.
Well, if someone hears this conversation you and I are having and thinks they might have one or more of the symptoms of diabetes or some of the risk factors, how do you suggest they broach this with their family physician the next time they go in to see their doctor?
Well, so first I would say if they're having symptoms, if they stop to think a minute and think, I'm really eating quite more than I had before, or I seem to be going to the bathroom a lot more often than I had been, or I'm very thirsty, or I have experienced blurred vision, they should make that phone call to see their physician right away rather than waiting maybe perhaps for the next scheduled visit. So I would make that phone call sooner rather than later. And have that appointment with their physician, or even let's say now they're not symptomatic, but they just came from a family gathering and found that a sister or brother or cousin has diabetes and they want to find that out for themselves. Make that appointment and say exactly that. My sister, my sibling has diabetes and I want to have myself evaluated to make sure if I do or don't have it. So I think that's a perfect place to start, is based on knowing your risk factors, and oftentimes the family history is quite strong.
Well, let's say that they present this to their doctor and the doctor agrees that it makes sense to do some testing. Can you go back over the numbers? So
Yes.
Let's say the doctor orders the test, the results come back, ready to review them with the patient. What should the patient know about those values?
Yes. So in making the diagnosis of diabetes, there are really two ways to do it. The most common one, and the one that's most advocated by the American Diabetes Association, is the fasting blood test. Now this would suppose that someone's generally in pretty good health, that they haven't experienced some acute illness, because sometimes that can make the blood sugars unusual. So you want to kind of be in your steady state, relatively good health, have a fasting blood test. And that typically means nothing after midnight. Most people getting their blood work between 7 and 8 a.m. They can drink water, but no source of calories, not a juice, nothing, not coffee with a little sugar in it. It should be really no calories. And then they have the fasting blood test. So that's the most common. And then the fast is anything above 126 or above is consistent with diabetes. Based on the ADA, at least to have it on 2 separate occasions, because then that would confirm the diagnosis of diabetes. There are other ways to do it too, is the oral glucose tolerance test, where sometimes patients manifest the diabetes not because their fasting blood sugars are unusual, but because their responses to a sugar challenge is abnormal. So an oral glucose tolerance test, they typically would have either impaired blood sugar, say between 100 and 125, or they can actually have, frankly, normal fasting blood sugars. They drink this syrupy drink. They should drink it within 10 to 15 minutes. 2 hours later, they have blood work. If that blood test is over 200, 2 hours after that test, that's consistent with diabetes as well. And it also should be confirmed on a second testing to be really sure that that's the diagnosis. So typically, I'd say the vast majority of cases here in the United States, it's the fasting blood sugar over 126. Anything between 100 and 125 is considered impaired fasting. Less than 100 is normal.